Hi, this is Dr. Jonathan Mainieri, and today we're going to talk about something that's really important, which is tennis elbow or epicondylitis, which a ton of people have. They don't even know that they have it, and they kind of misdiagnose themselves as having carpal tunnel syndrome. So epicondylitis, and we have our wonderful assistant here, Carissa. Epicondylitis here is, or tennis elbow, same thing, is usually where the muscles of the forearm attach to the humerus up here. And so the patients get inflammation and pain. And it can even be from not only playing tennis, but repetitive stress injuries, computer at work, because a lot of people right-handed doing mousing, 10 key. You can also get it just from repetitive stress, like doing dishes, laundry. But basically, these muscles in the forearm get really tight. And where do they pull? On the epicondyle of the humerus, causing inflammation. So the medical treatment, if you go to an orthopedic surgeon, they usually want to do a cortisone shot to reduce inflammation. Helps, but will it fix the problem? No, because we didn't fix the tight muscles and the scar tissue that's here. Right? There's two types of scar tissue. One is from post-surgical scar tissue, one is also from overuse. So the next thing to do, if that cortisone shot doesn't work, then what they want to do is they want to do a surgical procedure to loosen up the muscles by cutting them. Okay? Being in practice for 12 years, I've seen hundreds of patients. That surgery usually doesn't really work that well because it's not fixing the problem once again. So what we do in our office is it works amazing because it really fixes the problem. First we do some deep tissue massage here on the forearm. Then we do some electrical stimulation to get the endorphins and inflammation down. So the deep tissue massage will break up that scar tissue and the trigger points. Scar tissue has been building for years, and that loosens up these muscles so it doesn't pull on this bone and cause inflammation. Then we also do icing, and then some light adjustments here in the forearm. That usually completely heals it. They have better range of motion. We do have them do some icing at home, but the pain should be down just after a few visits. So this is not carpal tunnel. Carpal tunnel is on the other side. It's down here in the wrist, okay? And usually they have compression here of the median nerve that can attach, they can have compression here in the forearm or here. So this is not carpal tunnel, this is tennis elbow. So if you're having tennis elbow type of symptoms, before you get a cortisone shot or have the surgical procedure, do some conservative care. We've helped hundreds of patients with it. So I hope this has helped out with you, and I hope to see you soon in the office. You take care.